About medical imaging. This is the MRIs, the CT scans. You see all those scans. Sometimes we wait until we have to actually do it. That's the time to try to understand, is CT scan ni nini? Yeah? And there are many more imaging that we probably don't know about. So today we'll be talking about all that. But even before we get into the topic of discussion, I'm very happy to have all of you here. Thank you so much for tuning in. It's such an amazing Wednesday to have this particular discussion. Our numbers are very open. That is 0721 105 105 on WhatsApp, 23814 SMS code, which is absolutely free of charge. And on all social media pages at Rachel Kahugu, also be able to get your feedback. We're live on Facebook on MBCI TV Facebook page. We're live on YouTube on MBCI TV official YouTube page. And of course, on that as well, on the comment section, I'll be able to get your feedback. So for you to just be able to understand what medical imaging is, we have an amazing segment, which is the In History segment. This will help you understand, imambo ya imaging ilianza lini. Is it a thing of new technology or it's something that has been there? So we'll be getting to look at that. But for now, let's get the In History segment and then we'll be coming right back.
Medical imaging dates back to the late 1800s when Wilhelm Conrad Röntgen discovered X-rays in 1895. This breakthrough led to the first use of X-rays in medical imaging, allowing doctors to non-invasively visualize internal structures. The early 20th century saw the development of other imaging modalities like fluoroscopy and tomography. These technologies significantly improved diagnostic capabilities, but they had limitations in terms of image quality and the ability to visualize soft tissues. The 1970s and 1980s revolutionized medical imaging with the advent of computed tomography, CT scans, and magnetic resonance imaging, that is MRI. CT scans developed by Godfrey Hounsfield and Alan McLeod Cormack used X-rays to create detailed cross-sectional images of the body. MRI, developed by Richard Ernst and others, harnessed the power of magnetic fields and radio waves to produce high-resolution images of soft tissues. These technologies greatly expanded diagnostic capabilities and transformed the field of medicine. Today, medical imaging continues to evolve with advancements in technologies like positron emission tomography scans, functional MRI, that is fMRI, and diffusion tensor imaging, DTI. These modalities enable clinicians to visualize not only anatomical structures but also functional and metabolic processes. Artificial intelligence and machine learning are also being integrated into medical imaging to improve image analysis and diagnostic accuracy. These developments are pushing the boundaries of what's possible in medical imaging and transforming the way we diagnose and treat diseases.
So we are back. Thank you so much for staying. That is the In History segment. And of course, we've been able to just understand the background of imaging, medical imaging, what that is. And this might be a new term to some of the people, but we have just the right person to help us unpack this particular conversation. And the person that we're having today is called Esther Njokimumbi, and she is a radiologist currently at Mercy Mission. Atakuwa anatuambia radiologist ni nani, yeah, but also to tell us in extent what she does, why that is important to all of us. And sometimes, you know, we need to know what's happening inside our bodies without even doing the surgery, all that, to enable the doctor to treat you very well. And now we have the person who will be able to take us through this. Esther, thank you so much for coming.
Thank you.
How are you?
I'm fine.
You look amazing.
Thank you. You do too.
Asante.
You're welcome.
How are you?
I'm fine, thank you.
Thank you so much for being here today.
Thank you for having me.
Perfect. So there are people who are seeing you for the very first time today. I know it's also the first time that we're having you on Afya Clinic, which is really amazing because we can't wait to just know what radiology entails. I know there's so much. Yani leo tunafanya like an umbrella of everything that you do. But I know it's time we'll branch to what we actually need to talk about. But for the people who are just joining in or probably seeing you for the very first time, please introduce yourself. Tell us about what you do and who you are.
Okay.
Yeah.
Well, hi everyone. My name is Esther Njokimumbi. I'm born again. I reside in Nakuru. Currently working at Our Lady of Mercy Mission Hospital, Nakuru. I am a radiographer by profession. Of late, we've been including another term, radiosonographer. We will get to understand that in this session. and I am glad to be here. I hope that this segment or session will be impactful to you and you will learn something or get a better understanding of something.
Perfect. We can't wait to just learn more about that.
Right.
Let's just start by a radiologist. What do you do?
Okay. There is a radiologist and a radiographer. I am a radiographer.
Radiographer.
Yes. Basically what we do is we deal with radiation to produce images of diagnostic value. So basically we help the doctors to make a diagnosis or even ascertain a diagnosis but that has not been very clear in other clinical expertise. We also have another branch. It can either be diagnostic or therapeutic. Personally, I am a diagnostic radiographer. The therapeutic ones are the ones who treat a disease using radiation.
Okay.
Yes, for example, you may have had, someone had cancer and they had to do some radiotherapy sessions. Now that is a radiotherapist. So myself, I am a diagnostic radiographer and also a sonographer, meaning I also deal with ultrasound. Yes.
Okay. So we'll be getting to know the difference between the two of those.
Yes.
But I like to ask our doctors this question.
Okay.
Why did you choose to do what you do?
Oh, well, okay. I initially, firstly, didn't choose to become a radiographer. My intention was to become a doctor, so to directly go to campus and do medicine and surgery. But then I missed out on that, and I chose my second option, which was radiography in JKUAT. And over time, in the first trimester, of course, I had hopes to still swap and switch to the other career that I really wanted. But over time, I remember when I first went for my clinical placement at Kenyatta National Hospital in 2017. That is when I put a stamp on it that, you know what, it's radiography for life. Yes, I'm not changing it. So over time, I've developed a liking for it, so much so I currently enrolled as a part-time lecturer just to, empower the other ones. Yes.
Which university?
I'm currently at KMTC Nakuru.
Okay. I love that. Now, what do you say was your turning point? What was that? Is it something that you did? Were you on duty? Did you see someone doing some X-rays and you're like, I like what I see?
The first encounter was before I enrolled to campus. In JKUAT, it was mandatory for you to have a screening check, a screening chest X-ray for admission. So when I met with the radiographer at Naivasha that time, he's the one who talked more or even explained just a little bit what radiography is, because initially I didn't really know what it is. So he's the one that made me have the very first impression of it. And then after that, when we are done with our first trimester in school, in the second, I'm calling them trimesters because it's 3 in 1 year, unlike the other courses, which is 2 in 1 year. So after my first trimester, we went to Kenyatta for our first clinical placement. And there you interact with all the people, the nurses, anesthetists, all of them. And when I interacted with the radiographers at Kenyatta, I was certain this is the path. Yes, because having to see the unseen, not really, is something that is amazing. And just like the way you look at the stars and you marvel at God's creation, it's the same way when you're looking at a human body only in black and white and shades of gray. Yes.
Okay. Now, for nurses, doctors, we hear they have, or rather they've told us, they have some moments that are really traumatic for them, for lack of a better word. Would you say you've had any of those experiences in your line of duty?
Well, as a radiographer, that one is inevitable because most of the time you're the first will see that you're the one who will see, or rather notice the diagnosis first. You're the one who will know that this is a far gone cancer. You're the one who will know that the baby's heartbeat is not there. You're the one who will notice that this pregnancy ain't viable. You're the one who will notice some very good things, that it's not one baby, there are 2, they're very healthy. So it has the good sides, but also on matters diagnosis, most of the time you're the one who will see the first-hand information about the patient's diagnosis. And the most hard part of it is you do not disclose close to the patient. So you do your reports and you tell them to go back to their doctor will explain.
Okay.
That's a very hard part, because if they're asking is their heartbeat, you can't lie.
Yeah.
And you can't, there's no making them feel better, you know, but you have to tell them to go back because that's the protocol.
Okay.
Yeah.
Okay, so you don't get to disclose whatever you get.
Yeah, ideally, you're not supposed to disclose, but
Okay.
at times you may choose kindness over being right.
Yeah.
Yeah.
Because also people ask a lot of questions.
Yes.
I can only imagine.
Yeah.
So we'll get there because I already know what that imaging was. But there's this heart imaging.
Yeah.
Just to get to know if your heart is beating right. Initaje?
Echocardiography.
That one. Oh, I need it as echo.
Okay, yes,
Yeah.
it's echo.
Yes.
The commonly used term.
Yeah.
Okay.
So there's one time I've had that, but just, you know, because why not?
Okay.
Yeah. And I ask so many questions. Yeah. Is it supposed to be like that?
Yes.
Why is this wave bigger than this one?
yeah.
You know.
Okay.
So I can only imagine how patients ask so many questions.
Yes, they do.
And sometimes you don't have to, you're not supposed to disclose.
Yeah.
And then you decide, you know, why not?
Yeah, true.
Yeah, I can't wait to get into the depth of this conversation because I think it's going to be very interesting just to get to learn. So today we're talking about medical imaging.
Okay.
In layman's language, what would you say that is?
Medical imaging, just like it's taking, someone said that I take photos only in a hospital setting. So basically it's photography, only that you're using slightly different technology.
Okay.
Yes, because now photography is using light and now radiography you're using radiation. So that's majorly the major difference. It's just images.
Okay.
Yes, being used, using different mediums to acquire the images.
Okay.
Yes.
Perfect. Now let's start with what are some of the very common imaging?
Okay.
Yeah.
Yeah, there are two broad categories that I can use. One being radiation, the ones that have ionizing radiation, and the ones that do not have radiation.
Okay.
So the ones that have radiation, the commonly known X-rays, there's normal X-ray, which we call general or conventional X-ray. We have another one which is called CT scan or the CAT scan.
Okay.
We have, basically, the full term is computed tomography. The other one is called mammography. There's another one which is slightly obsolete called fluoroscopy and dental radiography.
Okay.
Yes.
Okay.
And then the ones that do not have ionizing radiation, that is, an example is MRI, which uses magnetism.
Yeah.
And we have ultrasound, which is using sound
Okay.
to make images.
All right. Now, what's the difference between the two? The one that has the ionizing?
Ionizing radiation and the one that doesn't have. The one that has ionizing radiation is the one that is using X-ray radiation, nearly a X-ray to make the images. So you may find that CT scan and X-ray, they're using radiation, only that one has a little more amount than the other one.
Okay.
Similar to X-ray and mammography. Mammography will have lower levels compared to a general X-ray.
Okay.
So both of them are using radiation. When we were studying the spectrum, the one that you have radio waves, microwaves, the UV light, now there's X-rays being a part of it.
Okay.
So medically we use X-rays, but when you advance to some other things like nuclear medicine and PET CT scan, PET CT scan will also use X-rays, but for the nuclear ones you'll have now other things like gamma rays, which are more stronger than the X-rays.
Okay.
Yes.
Perfect. Now, before we even go to the ones that don't use the ionizing radiation,
Yes.
I'll have to get that. Now, before we go to that, let's look at the ones that use the ionizing radiations that are very, very common, which is the CT scans and the X-rays. So at what point do we use the X-rays?
The X-ray is the general one. It's the one that is first-hand when we want to check, for example, you've had a case of trauma and you want to check if there's any fracture on your body. That is one. Also, when we are doing the screening, for example, for tuberculosis screening, we may need to do a chest X-ray for us to check how your lungs, your lung fields are and your thoracic cavity as well. So basically, most of the time, X-ray is just a black and white photo of your skeleton. Yes. It is very good in bone visualization. It is not very effective for soft tissue. That is why you wouldn't hear someone saying that I had my liver checked using the X-ray. Because it has a high specificity for, you know, the bone, the skeletal aspect. So, but it is also good for some soft tissue. For example, when you're checking for the paranasal spaces, for people who snore, especially the kids below 6.
Yeah.
When you go to the hospital, the doctor might ask you to go do a post-nasal space X-ray so that we may check whether there's the tube is being obstructed by something.
Okay.
So that is basically X-ray. But now for CT scan, it is used for, it is superior than the X-ray, that is one. And it is also used to check more serious, if I may call it. So more serious things. Because the CT scan is the one that will give us the staging for instance cancer. It's the one that is used to stage cancer. The CT scan will be able to visualize even the soft tissues, the liver, the kidneys, and the like. Also the brain. It is hard for you to do a head X-ray because it won't be very effective. I will not see the brain on X-ray, but I can appreciate the brain on CT. Okay. So all of them, they check at very specific things. Yes, depending on the clinical question.
Okay.
Yes.
Okay, I hear you. And now on the ones that do not use ionizing radiations, you've mentioned these are?
MRI and ultrasound.
Okay. So let's start with the MRI.
The MRI. Now, MRI is magnetic resonance imaging. Yes, I hear people saying that, oh, me and that friend of mine were not resonating on the same frequency. So when you say that, us as medics, we flip to MRI because MRI basically uses magnetism and radio waves to make images. So it has no radiation. It is not harmful to anyone because the earth itself has a north pole and a south pole. So basically it's a magnet in itself. And our body are made up of water, which has most hydrogen, and the poles have a negative and a positive side as well. So it basically has no side effects. The only thing about MRI is for your first time you might be shocked because it's big, it's huge. It's not like an X-ray. And also there are two types. There's a closed one and an open one. For closed one, you're basically being put in the machine. And so for people who are claustrophobic and they don't like small spaces, they might not be very comfortable being in the MRI machine. And also because of the makeup of the machine, it has a lot of noise. MRI has a lot of noise. There's a lot of clicking and clacking of metals. So, but with the advancing technology, some of them may have things that may be accommodated in the magnetic room. Such that you can put some headphones on the patient and probably play them their favorite song just to distract them from the noise in the room because it actually has a lot of noise. Something else about the magnetic imaging, it depends. It may not be done on everyone because if you have a magnetic material or implant on you, you cannot go to the magnet. It will be pulled out, which is a very serious case. Actually, in July, there was a case of someone who lost their life because they did not remove some metal they had on their neck when they were going into the room.
Like a necklace?
Yes, so if you're having a necklace, it should be totally non-magnetic. Otherwise, the machine will pull it out. And it doesn't have the intelligence to pull it out of your head. It will just pull. Yes, so it can be a hazard. But good thing is that now that is known, there's always a checklist. So if there's something you answer, and also before you get to the machine, there is a check room where a detector, like the ones when you're passing through the mall, like that one, only slightly advanced. So that if you have anything magnetic, it can be detected. Thus, the hazard is taken care of.
Okay. Now you've mentioned something about the magnetic imaging, that there's the one which is enclosed, and then there's the one which is not. What's the difference?
The difference is just how it...
Then after that, we'll go into the details. So if you have any question, please feel free to ask on our numbers, as I had said before, that is 0721 105 105. That is on WhatsApp to 3814, SMS code, which is absolutely free of charge. We're live on Facebook on MBCI TV Facebook page. We're live on YouTube on MBCI TV official YouTube page. Now, ultrasound. I know this is a common name. But just explain.
So ultrasound is an imaging technique where you're using sound waves to form moving images. So this one is not something that was invented like initially, like started from zero. because from creation we have animals like dolphins and elephants and bats which use sound waves to detect motion or even their surrounding, to understand the surrounding. It was also being used by the submarines in the World War II to detect the enemy, whether they're approaching or not. So ultrasound has been there, but now being used in imaging, it started I think around 1971, 1979, around that time. So ultrasound is basically, the word ultra, it's sound waves that are too minute for a human ear to perceive. So it uses sound frequency to make moving images of the body. Yes.
Okay. Now, at what point does the doctor decide what exactly imaging do you need?
Okay, the clinical question. Yes, the clinical question that needs to be answered is one that it determines which modality to go for. For instance, if I'm checking on something skeletal and it's not a skull, or I just want something skeletal in general, an X-ray would suffice, it will do. But if I need more details of the same skeleton, I would choose to go skeletal system, skeletal part. I would choose to use a CT scan. But then when it comes to things like MRI, it is very good for soft tissue imaging. But for CT scan, it's very good for soft tissue and bone imaging. Those are different. And also when it comes to ultrasound, it has a high preference because one, doesn't have ionizing radiation. Number two, it is very good for soft tissue, which is the bulk of our body. So it depends with the clinical question at hand and also the patient presentation at that time. Yes.
We've had ultrasound ikitumika sana for pregnant women. To check if their pregnancy is okay. At what other point is it used for?
Well, I tell people that we do ultrasound for the entire body and they are shocked or they wonder. Some men will even ask you, why are you using this machine on me? It's supposed to be for... But then after you tell them, they get to understand that it is not particularly for pregnancy. Actually, I tell them the fact that we're using it on pregnant women and children who are not yet born, the fetuses, tells you how safe it is. So ultrasound is very good for soft tissue imaging. You can do it on basically every part of your body. There's one for the eye, which is called orbital ultrasound. There's one for general, there's abdominal ultrasound. I want to check your thyroid gland, I'll use ultrasound. I want to check your blood vessels on your upper arm or your lower arm. I'm going to use ultrasound. I want to check, you've been hit by something and there's a swelling, and we want to check what's the damage or the extent of the damage. It is still ultrasound. So anything soft tissue, ultrasound will do. The only time that it becomes restricted is when you have to check for bones, which now at that time you might need an X-ray. Yes, but if it's anything nerves, anything blood vessel, anything organs, ultrasound will do. Yes.
Perfect. Now that you have a background of what that looks like, I'd love for us to get the vox pops. So this is where we get to talk to a few people outside to get to know what they understand about medical imaging, what they know, what they don't. So let's take a look at that and then we'll be coming right back.
Sababu yenye inafanya tuseme kama mwili yako ina uvimbe ambayo haijulikani ni nini iko ndani. Daktari wameangalia, wameshindwa, sasa wanataka kujua ni nini iko ndani. Kwa hivyo wanakutuma either scanning ama ultrasound. Natuma huko, unakaguliwa na mashini zao. Sasa inatoa ile uvimbe ni nini iko ndani, ama hiyo ugonjwa yenye haionekani ni nini iko ndani.
Hiyo scanning bedha kuskaniwa maybe kama mimi mwenye naendesha bodaboda hivi, maybe unaelewa hii mambo ya barabara, maybe naweza anguka hapo kwa barabara, maybe mfupa ikateguka ikaenda side nyingine. Daktari naye aswa haezi jua hiyo mfupa iko ndani ya ngozi, si ndio? Daktari naye aswa haezi jua mahali imeenda. Lazima aniscan aone hiyo mfupa imesonga design gani, airudishe ikae level moja, si ndio? So hiyo ndio ningesema mimi. Hiyo saa ndio inakuwa scanning iko sawa. Akiniscan anaona mahali mfupa imeteguka, imetoka joint fulani irudi mahali fulani. Akinirudisha hivyo, hata hiyo scanning imemsaidia hata yeye na kazi inakuwa sawa.
Mtu anafanywa scan ama X-ray kwa sababu unaweza pata ugonjwa umekosa kujulikana sana. Kwa kufanya hiyo x-ray unapata unajua chanzo cha ugonjwa wake.
Mtu ukienda hospitali kufanyiwa scan, mbevi ukuo ulianguka, ukakiraka ama ukavunjika. Sasa juu daktari hawezi toa maono yako kama nja kupitisha kwa scan, lazima uingie kwa scan, ile scan itoe maono yako, ile daktari naye aweze kukuadhibu kulingana vyenye ameona kwa mwili yako.
Main purpose inakuwa kufanya diagnostics na kujua haswa ugonjwa mtu anaugua ni gani. Hiyo ndio the main reason. Yes.
Scan ni watu wanaenda, hata mimi nikitaka naweza enda, lakini mwenye anaweza enda ni mgonjwa tu. Juu kama mimi si mgonjwa italeta shida. Scan inakuwa mbaya sana kama wewe si mgonjwa. Kama wewe si mgonjwa, scan inakuwa shida, itakuletea madhara. Itakuletea shida, labda uko na shida kifua, lakini ni short tuseme aje, mwenye anaenda kwa scanning feel poa, lakini si unajua kwa scanning tuendi pale kujienjoy. Ni kweli hakuna, si mchezo ikiwa hapo. Ni mtu akona shida. Sasa mimi nikienda pale na mimi si mgonjwa, itaniletea shida.
Perfect. So we're back, and that is what we have on the Vox Pops today. I hope that we get to learn more about medical imaging and what that is. Now, we've had people talking about exposure to X-rays. And now that you know what X-rays are, and that the X-rays and the CT scan, mammography, they have ionizing radiation, and we have other imagings that don't have. No, you've explained what's the difference and what that looks like. But people especially relate with the X-rays, and they say, "Mimi spendi X-rays because iko na rays, and it's not good for the body." Please explain.
Well, that is not a lie. I would say that. But for a doctor to send you or to ask for an X-ray, the good must have outweighed the bad. There's a rule in radiography that whenever you're doing an X-ray, it has to go through 3 stages. Number 1, you have to justify why we are doing an X-ray. Why are we using an X-ray instead of any other modality? Why this one and not the other ones? So after justification, there's optimization. That you ensure that the amount of radiation you're going to use is minimal, but still acquiring a very good image, because you don't want to compromise the quality of the image in the name of using very minimal radiation.
True.
So there's also another rule, which is a principle in radiography, which is called the ALARA, A-L-A-R-A, as low as reasonably achievable.
Okay.
So whenever you're using radiation in whatever capacity, you're supposed to use the 3 to ensure that you're checking the welfare of the patient, the environment as well, and at the same time acquiring quality diagnostic images.
Okay.
So most of the time people feel some type of way not to have an X-ray, and probably have the other ones that they know do not have radiation. But most of the time, the amount of radiation that you actually get is very minimal, very, very minimal. And over time, they've come up with ways to minimize radiation to any other part. That is why even when you're having an image, you'll notice that the light is only at the place of interest. You do not have an X-ray of the entire body, yet I only wanted to check your hand. So I will only image your hand. And the amount of radiation getting to your hand is very minimal. Almost insignificant. Yes, I wouldn't say that it would cause anything. You wouldn't feel any taste. It doesn't have any taste. It doesn't have any smell. And also you won't feel anything on your skin. Yes, I basically tell people it's like taking a photo on your phone. You don't feel anything. So it's the same way, only that this one is using some type of radiation, but most of the time it's very minimal. Yes.
We've had people saying that it causes cancer in the long run.
Yes. I think most of them follow what happened by the fathers and the founders of radiography, which for their case it's different because like the one who first introduced X-ray, Wilhelm Conrad, himself he used to experiment on his wife Anna, and he would take X-rays of her hand, and the first very successful X-ray took 15 minutes. And right now the X-ray doesn't even go for 10 seconds. At most you have like 2.5 or 2 seconds, very minimal time, or milliseconds. We actually use milliseconds and seconds. So if you compare 15 every day experimenting, and her in the long run she died of cancer, yes, but I wouldn't say it's the similar case to us. So yes, I'm not negating the fact that radiation does cause cancer, but and has a high chance of causing cancer and making the cells grow. But I wouldn't say that the amount that we're using for diagnostic purposes would have that as a side effect, because we are not having X-rays every day. That is one. For patients, most of the time they're not taking the X-rays every time. And for us who are practicing, the rooms where the X-ray machine are found, they are very they are built in a different way. Like the wall is thicker than normal. The doors are heavier because they are lead lined, because X-ray cannot pass the lead lining. So we are also protected from them. So I wouldn't say, initially when it was starting, yes, we had so many cases of even practitioners in the end having cancer, but of late that has been minimized because the modalities and the technology, it is faster, and so we're using lower doses. Yes.
Okay, perfect. Now I'd want for us to check some of the mythbusters. Now that we're talking about some of the myths, and then with that we'll be looking at what are the actual side effects, and how would you be able to deal with that. Now let's look at some of the mythbusters, and the first is that MRIs use radiation just like X-rays.
That is not true. Because MRIs, when you get the full name, magnetic resonance imaging, that one is using magnetism. Yes.
Okay. And the second one is that ultrasounds are only for pregnant women. This is very common.
Yeah, that is very common. No, I think it's because when it first started, it was started with women, away from pregnant women, it started with women. It was a woman who had a very large cystic lesion. It's something that is fluid filled. And the doctors had come to a conclusion that, you know what, this is an inoperable cancer. But then the person who introduced ultrasound did the ultrasound, and the cyst was removed, and the woman was fine. So after that they saw that, oh, so we can use this one for soft tissues and other soft organs, and they were like, you know what, now that it is using sound, we can also use it for pregnancy and monitor growth. And so they started using it, and it became very prone and very common for pregnant women. But no, it is not for pregnant women alone. Yes.
Okay, well said. And the other one is that you only need scans if you're seriously sick.
No, that one is not true, because these days we do routine screening and routine checking, which helps, because some of these conditions, when they're detected early, the prognosis is very good at its best, because some of these things, they just need to be caught early and dealt with as soon as they're seen. So these days we don't do scans because we're sick. Yes, these days we do scans just as a normal routine health checkup. Yes, depending on which scan it is. Of course, you wouldn't go for CT scan and say, nataka tu kujua how I am. No, they will send you, you go to maybe ultrasound. If now ultrasound flags something, you might be sent for another imaging. But now ultrasound, but there's some, for example, which are using radiation, yes, but the good also outweighs the bad. For example, mammography for screening of the breast cancer, which mammography has a very high chance of detecting very early, and also for routine, just to be sure that you do not have anything alarming.
Yes, very important. And the other one on Mythbusters today is that medical imaging is always painful.
Well, I do not think medical imaging is painful. But there's some imaging like CT and MRI, where you may be needed to be injected some contrast, some dye, so that the very subtle things that cannot be seen on an otherwise normal scan may become apparent. So when we are having to fix a branula, you might feel pain, but the scanning process itself, doesn't have any pain. You wouldn't feel nothing. It doesn't have a taste or smell. Neither will you feel the rays coming in or coming out. Yes. So it is not painful.
Okay.
Yeah.
So do we have any of the imaging that you can actually feel anything, any sort of pain or change, any of the imagings that we've talked about or that we haven't talked about? Do you have any that you'd feel something?
Yeah, we have a very work generation, so I wouldn't lie that mammography can be quite uncomfortable. Not painful, but quite uncomfortable because of its technique, the way it's done. It might make you feel some pain or some discomfort, basically. Yes, but the other ones, no. Also, there's some which are slightly invasive, depending on what investigation is being done. Yes, some of them you might feel pain because of the condition you're presenting with, not because the imaging in itself is painful. But generally, imaging is not painful. Yes,
I hear you. So for mammography, what's the difference?
What's the difference
mammography and X-rays and the CT scans?
Number one is the modality that is being used. The setup of the machine is different. The other one, mammography, is specifically for the breast tissue. So it uses very low doses of X-ray. And yeah, that's it. Very low doses of X-ray, still an X-ray. And also it's very specific. Unlike X-ray, which you can have an X-ray of the skull, the head, the foot, an ultrasound of any body part, a CT of the entire body, an MRI of the entire body. Mammography is very specific, specific for the breast tissue. Yes.
Perfect. Onto the other myth buster that we're having today, which will be the last on our list, is that X-rays and CT scans will most definitely cause cancer.
Well, that's definitely no. We've had 1,000, a million CT scans being done on different people, and no, it's not a side effect. I wouldn't say the way you do, it's not a consequence. It's not like a proven thing. It's not cast on stone that when you have X-ray and deal with radiation, you're definitely going to have cancer. No.
Yes. Now, what are some of the other myths that you've had in your line of duty? What would you say is the most common?
The most common one is the X-ray machine emits radiation all the time. No. So you might find there's a portable X-ray, that the one that you move from one ward to the other one. So there are times you would get into the elevator and people don't want to come into the elevator with you. They're like, hey, no.
X-ray.
Exactly. So no, it does not emit radiation all the time, at all times. Other patients are not comfortable, clients are not comfortable being in the X-ray room, even when you're not exposing, because they think the radiation is on all the time. No, it's not. It's only on when you're exposing. When you're done, it's not on. Another thing that people say is when I do an ultrasound on a very early pregnancy, I increase my chances of maybe having a miscarriage. That is not true. Ultrasound has no effect on the patient, on the baby, or even to the practitioner, the one using the ultrasound machine. So that is another one. I don't think I have a lot, but yes.
Perfect. Now, what are the actual side effects of the imagings? We'll start with the X-rays, CT scans, the one that has ionizing radiation, and then the ones that don't.
So for the ones having ionizing radiation, when you use very extreme amounts, the ones that are not stipulated in the diagnostic margin, you may have issues like cancer is one of them. The other one is loss of hair, alopecia. The other one is skin changes. Those are just but to mention the ones that are there. And the other one is gene mutation. But these are very extreme cases. For example, there's a very good example of Chernobyl or the Hiroshima and Nagasaki, the ones that the bombing had something to do, had some radiation impact. So you find out that even years later, people still get born with either more digits or less, or they do not have an arm or a limb because of the effects of radiation, that because of the incident that happened earlier on. But those are very extreme cases in very extreme levels. Because, like, for example, the one in Chernobyl, it's because there was a nuclear plant explosion. So you see, for that one, it's very high amounts, which cannot even, because even we usually have radiation monitors, which can be able to read and detect the amount of radiation getting to you as a practitioner, or even the one that is coming to the room where you're working from. So those ones will tell you when your machine is faulty, when something is not working, or when your levels are too high. But basically, most of the time, you wouldn't have very high doses being given to a patient. And for cases where very high doses are used, it's very specific cases. For example, in radiotherapy, where you're using the radiation to either shrink a tumor or even treat a cancer patient. So that one will not, the radiation won't really differentiate between the sickly cells and the healthy ones. So it is going to affect all of them. That is why you'll find them having loss of hair, their skin having some very dark patches, among other things, because the cells are very prone to damage, especially when exposed to radiation. But for other people, we are making these cells day in, day out. So whenever you have the chest X-ray, you won't leave the room feeling fatigued or tired, or because your blood level has gone down or something. No, you're not going to experience that because it's very minimal and it is very optimal to get an image.
Okay, okay, very interesting, because most of the people say, especially after you've seen the cancer patients, after they've gone for treatment for a few months, and we see hair loss and stuff like that. Now people will be talking about, the MRI, the X-rays, you'll have side effects like hair loss and all that. So explaining that was very, very, very important. Now, on the very subtle side effects, like feeling nausea after the imaging, things like that, or maybe having a migraine. Do you have things like that?
These are very rare, but also on some imaging, for example, CT scan, I said there's some imaging that you might need to be injected a dye, a contrast, which is going to line the area of interest very well for you to be able to pick the very small differences that you cannot otherwise pick without using the contrast. So that contrast may have effects for different people in different ways. As for dizziness and the other one is nausea, not really. You do not experience that because it doesn't have a taste back to it again, doesn't have a smell. So you're basically not feeling anything coming into your body or living. Yes, for some imaging which are very long, for example, MRI, that one you might feel tired, but I don't think it's because of the imaging. Basically, most of the time it's because of the underlying condition that is necessitating the imaging in the first place.
Yes. Are there any precautions that one would take just to make sure that there's no issue that would come up later?
Yes. In imaging, especially in X-rays, the ones using ionizing radiation, for all women, we have to ensure that you're not pregnant. We do not do X-rays on expectant women. Yes.
Wait, so how about it happens, I'm doing an X-ray on my hand and I'm pregnant. Is that going to affect my pregnancy?
Well, the clinical question, back to justifying, do we really need to do it? Because we can always come up with measures to protect the fetus. You can have a lead gown. There's a very heavy cloth that sometimes you put on when you go to an X-ray. Or maybe you've taken your friend, you're not the one who is sick, but you have to be in the room, probably to aid in, to assist in putting the patient in the proper position. So there's a very heavy gown that you put on, which is lead lined, which cannot allow X-ray radiation to get into your body. So unless it's really necessary for you to do anything to do with ionizing radiation, when you're expectant, it's a no.
Yes. How does the X-rays or the rays, how does it affect the fetus?
Yes, because we tend to see or think in the line that these fetus, especially in very early pregnancy, that is when they're developing. So if any of the X-rays get there, they will affect the development of the baby. The cell division, the growth, the development part is very crucial. So when they have mutation at that very early age, then we are bound to have some issues later. Yes.
Okay, very interesting. Now let's give an example of a tooth X-ray. Is it an X-ray for the teeth?
Yes, it's
yeah?
tooth
It's an X-ray.
Yeah.
Yeah, it's a tooth X-ray.
Yeah.
So assuming you're doing a tooth X-ray, does it have any effect on the lower body?
Not really.
Not really?
But now, you see, I like the fact that we're using a lot of lights. You see the way we used to study interaction of light with matter. There's reflection, refraction, diffraction. X-ray does the same thing.
Okay.
So in as much as I am pointing my radiation there might be some of them which may scatter or diffract. And now when diffract, it might get to another place where it was not intended. So most of the time we tend to cover the patient or just put to cone at the area of interest specifically, so that you do not have the whole area being exposed, yet I only need one tooth. Yes.
Okay, how about the upper body? Because again, the upper body is not covered.
No, it's the light, it's only coned to that area.
Okay.
So I'm not
Also the light
the entire
is,
thing.
okay.
Yes, that is the passage of the X-rays.
Okay.
And they travel in a straight line. So there's no way it can come and then if...
Yes, no. Makes sense, makes sense. Now for the ultrasound, mostly, as many people know, is that it's used for pregnancy, and it's good that you've made it clear that it can be used even for men, any part of the body, but specifically for the expectant women. What exactly does ultrasound check for?
Wow, so ultrasound is quite interesting, because from the very beginning, when the fetus is forming, with total no heartbeats, you'll be able to see it. That is 6 weeks and below.
With no heartbeat?
Yes, with no heartbeat.
Okay.
You just see a fetal pole, but there's no heartbeat.
Okay.
And then we'll ask you to come back in a week or two so that we can confirm whether there is a heartbeat. So that one is basically called a viability ultrasound scan.
Yeah.
So that one is in the first.
Very interesting.
Okay.
So a heartbeat of a fetus,
Okay.
At what point does it develop? When the baby is how many weeks old?
Anatomically around 5 weeks, but now for you to appreciate it on ultrasound, it's around 7 to 8 weeks.
Okay.
Yes.
Interesting.
So now when that is the first one, the first ultrasound scan, which is called viability, and also for location. So for us to tell you whether it's inside the uterus or outside. That is why you'd hear of issues of ectopic. So when you do an ultrasound scan, very early stages in pregnancy, we're able to tell you the location. We're able to tell you whether it's viable. We are also able to tell you the number, whether it's 1, 2, 3, yes. We're also able to see whether the uterus is normal. There are no uterine growths, fibroids, or anything that might cause any harm to the fetus. So then after that, if we go to the second trimester, but before we get to the second trimester, between 10 to 13 weeks, we can do another scan that is called the first anomaly screening. That is, it's not the main anomaly scan, but we can just screen. So there are things we check to see whether this fetus, whether there's a red flag, whether the fetus is normal or not. And then after that, we go to the second trimester. We prefer to do it around 20 to 24 weeks because in this window, we can be able to tell you the gender. We can be able to detect any anomaly. And also, we can be able to show the mother the profile of the baby. Because at this time, you can appreciate. If you come too early, I may not be able to tell you where the eyes are. And I might be able to see them, but you'll not appreciate them. But when they come around that time when the baby is fully formed, you can be able to actually fully appreciate every part of the baby.
Okay.
So that is the second one. And then in the third...
continue, you said you'd be able to also know if there are any abnormalities.
Yes.
Yeah. So in an ultrasound, what does a normal fetus look like?
A normal fetus, like a normal human, like a normal baby, even I say so. Like they will have 5 fingers, or they will have a normal foot and not a club foot, not feet that are inverted or diverted. they will have normal lengths. The body will be proportional. They will not have very short limbs, but a very normal body.
Okay.
The brain as well. You check whether it's developing. You might have had people saying that aliambiwa mtoto kichwa iko na maji, something like that. You might be able to tell that in that anomaly scan. So you're checking the normal growth, the normal anatomical features of the baby, how the heart is beating, whether the heart has any issues, whether the general outlook of the body of the baby is normal. So basically you're checking at all normal things that a human should have, only that it's a very tiny one.
Okay.
Yes.
Is there something that can be corrected at that stage?
Unfortunately, most of the time, no. On the body, on the baby. Not really. Yes. Most of the time, not really.
Okay.
Yes. But now it's better when it is known early because we're also checking at the psychological aspect of the mother. You know, you'd rather be told and be given your options rather than waiting. And then for example, you might find some very disturbing anomalies. You might find a baby, but there's no head. You might find a baby with a head, but no brain. You might find a baby, but they do not have an arm, or they do not, or they are, what are they called? The Siamese twins, the conjoined ones. So everyone has their own things except for the heart. They're sharing the heart. So the mom has to be prepared that these people will have to be like this for a certain period of time. So for some of the anomalies, there is nothing that can really be done about them. But it is good for the mom to be told early so that they're well prepared.
Okay.
Yes.
Okay. I hear you. Now, we are at the second stage.
Oh, the second trimester, yes. And then in the third trimester, those ones, we call them the growth scans. Now we start monitoring growth. Development has already occurred. Every body part is already there. Now we're checking growth. Now at this point is when we'll start discussing the weight. If the baby is adding weight normally, if there's some restricted growth, you might notice that at 30 weeks the baby was like this. At 34 it's almost similar, so that's a red flag. And also we are able to check some other things like the umbilical cord, whether it's going around the neck of the baby. We are able to check the placenta, whether it is low-lying, such that it is obscuring the cervix. And if it is, then the mother might need to have a discussion on the mode of delivery. Because the natural one might not be an option. So that is in the third scan. In the third trimester, you check that you get the growth rates. You also get to decide on the mode of delivery. You also get to flag any issue. Also in the third trimester, with the latest issues that we might be having, you're able to alarm or alert the doctor that we do not need to wait at 40 weeks. Can we just deliver this baby now? Because the ultrasound highlights this and this and this. And if we wait, we might not have a very good outcome. Yes.
Interesting. With technology, things are really changing. Maybe let's just talk about for the ultrasound and in general the imaging. What would you say are the changes in technology that you've seen? Of course, apart from what you've already talked about, the issue of cancer. Where the imaging is takes very short time, like milliseconds or seconds, and you're done for for the X-rays. Apart from that, what else would you say that technology has done to the imaging?
Wow. So it has really advanced over time, and there's also very fast access. Because some years back we will say that we only have like 5 ultrasound scans in Nakuru County, but I don't believe that's the case right now. There are so many. So the accessibility and availability is very good because people are able to detect things at a very early stage when something can actually be done. Another thing about the technology is where it's really advancing also with AI, because some of them are coming with a fixed AI in them, so you're able to really pick. Sometimes we have to do an ultrasound and then I have to send you for a CT scan because the ultrasound didn't really confirm what I needed. But with advancement, with clear imaging, with higher machines and modalities, we are able to really narrow down to what the issue is. We do not give so many differentials that it could be A, but it also could be B. So at this point, most of the time you're finding that we are giving it's A, and actually it's A. Also, there is the word They're becoming better, I think, because, for example, MRI scanner, the ones that started had very low strength, and they would take almost forever, like 15 minutes to do a spine imaging, and 45 to do a head scan. But then you may have some which are very fast, like one in Kenyatta, which will only use 5 minutes when you're done with the scanning. So the advancement comes with, it becomes more efficient, more effective, faster. So patients do not have to wait for so long. Some time back, when a CT scan was done, it would take so much time for it to be printed, for it to be for the scanning, for the printing, and for to get the report back. So the patient might also be, the health might also be going down. But this time they're very fast. You can easily pick these things and flag them. If there's need to flag, you flag. If there's need to wait, you wait. If there's need for comparison with another image, you can also do that. But so far we cannot do one without the other. I don't think we've come to a point where we can say we do not need X-rays. Let's only use ultrasound. Yes.
I think when you get to that place, it would be really nice. Where we get rid of the X-rays and everything that has the ionizing radiation. That word. Probably we get there, and that would be so good. Or just improve, because as you said, is that there's a lot of improvement. Where you get to realize that it only takes a few milliseconds and you're done with the X-ray, which means it doesn't have any effect on your body. Also, you say they're very accurate. So that's something. Perfect. So we're taking a very short break and then we'll be coming right back. Today we're talking about medical imaging. These are the X-rays, these are the CT scans, MRIs, all the scans that you'd think of. So if you have any question, this is where we get to answer you. All right. So this is Afya Clinic. My name is Rachel Kahugo. We're taking a very short break and then we'll be coming right back. Sende mbali.
MBCI Television, transforming lives.
Across the valleys and the hills of Ngong in Kajiado,
land of Kenya,
a cry is rising.
We command the land.
A cry for healing.
We release the land and the people and the resources. We dedicate them back to our God.
A cry for revival, the land and for the people. This October, Missions to the Body of Christ International MBCI, in partnership with Kajiado Northwest Clergy and Gospel Ministers, invites you to a 7 days of prayer and word festival. The Healing of the Learned Prayer Conference at Ngong Stadium inside the mega tent, starting from Monday 29th September to Sunday 5th October 2025. Ministering Apostle John Kemani William and other choice servants of God. Our land is good and pleasantly situated, yet it's unproductive and has been hindered. But now a time of healing has come, a time of restoration, a time of revival. Come, let's call on the Lord together. The conference will run daily from 9 a.m. to 6 p.m. with a morning devotion every day from 5:30 a.m. A glorious Friday cashier from 9:30 p.m. and the grand climax rally Sunday at 2 p.m. will be live on MBCI TV and MBCI Radio and all our social media platforms. This is an interdenominational gathering, free and open to all.
Kuna ile wimbo yenye unapenda ya gospel ama ya church, tuimbie tu ka chorus kadogo tu.
It's about to go down. Continue.
Kwa sawa.
Founder wa TikTok ni Mchinese. Jina yake ya kwanza ni Zhang. Kulingana na wewe, anakaa kuitwa Zhang nani?
Shut up everybody. Listen.
Zhang TikTok.
Wait. What did I hear?
TikTok Zhang.
The only table yenye hukuliwa ni table gani?
Ni meza ya bwana. Meza ya bwana.
What is that?
Inaitwaje kwa kizungu?
Table of Jesus.
Today at Bounty Supermarket, Imani Mall, Nakuru. Other branches are in Nakuru Racecourse and Olivine Kiamunyi. Bounty Supermarket, great savings every day.
MBCI Television, transforming lives.
All right, we are back. Thank you so much for staying. This is Afya Clinic, where we talk about everything that concerns your health. And today we are talking about imaging, medical imaging. Maybe just to do a recap, yeah? So today we are having Esther, and she's a radiographer. You said a radiographer and a radiologist. They're two different people.
Yes.
Yeah. Please explain. What's the difference?
So radiographer is one, it's actually the technologist, the one who takes the images, the one who does the scans. For the ultrasound, you may have noticed that the one who will do the scan on you will also do a report. But for the x-rays and CT scan, the one who will do the scanning will not do the report. So the one doing the report is a radiologist.
Okay.
So it's different on the terms of the number of years and also qualification. For one to become a radiologist, you need to do medicine and surgery first, then specialize in radiologist as a master's.
Okay.
And then when you do radiography, you can do medical imaging at KMTC, then upgrade currently only in JQuat to do a degree now in radiography, or you can just do a direct entry.
It's really diverse. So just understanding the difference between the two, it's really important and very interesting.
Okay.
Yeah. So today we're talking about medical imaging. For the people who are just joining us now, maybe you just do a small recap of what are some of the imaging that we'd have.
Okay.
Yeah.
So the modalities, the medical imaging that we have the X-rays, we have the CT scan, we have the MRI, we have the ultrasound, we also have fluoroscopy and mammography. Yes.
Okay. For the ones that are not very common, like the fluoroscopy, please just give an explanation of what that is.
Yes, fluoroscopy is basically X-ray, but now having moving imaging. Yes, you're taking continuous images, like a video. And like the other one for X-ray, it's a snap, and then you print it out or send it for imaging. But for fluoroscopy, you're having live imaging. You're imaging the blood vessel or the body parts live. It's a short video. Yes, of the
Why is that
parts.
important?
Why is it important?
What's the difference?
The difference between the two. It's just the technique. One, you're having a static image. The other one, you're having a video. For example, when I want to check the tubes, for example, the renal tube, the ureters, or maybe a blood vessel, or when I want to check the esophagus down to the stomach, to the duodenum, to check for ulcers or strictures or any other anomaly, fluoroscopy may come in handy because we are following the entire tract. But for the other one, the static image, I only want to see the lung fields and the heart shadow and the ribs.
Okay.
Yes.
Okay. Interesting. All right. So that's the fluoroscopy.
Yes.
Which are some of the other X-rays that's not, or imaging
that are not very
common.
There's one that is called the PET scan. Yes, that is a combination of PET and CT.
Okay.
That one is mostly used by cancer patients when you want to check the staging or even to check whether it has come back. So yes, that one is not commonly done.
Okay.
Yes, and they're not very common actually in the country. Yes, most of them are found in Nairobi.
Okay.
There's Aga Khan, there's one at Nairobi Hospital, and I think one at KU Referral.
Okay.
Just to mention a few, those are not all of them.
Yeah.
Another one that is not very common, is there another one that is not very common? No, the other ones depend on the clinical question, the area, the demography of the area also.
Yeah.
Yes.
Okay. For the PET scan, why is it that it's not very common? And, especially, for the cancer patients, this is something that's very much needed. Why is it that it's not very common?
Because it is very expensive. Number two, it is incorporating two disciplines.
Yeah.
It is incorporating radiography and nuclear medicine. Yes.
Okay.
Which is now a whole other thing.
Yeah.
Yeah. It is not like X-rays are just X-rays, basically medical imaging. But now when you go to PET scan, PET CT, you're having CT, which is in now radiography, and you have PET, which is basically in the nuclear medicine field.
Okay.
Yes.
Okay. Interesting. Now we have some of the questions that are coming in, and just to let you know is that our numbers are very open. You can ask the questions, and at the end of the show we're going to be sharing a number that if you have any question or any concern, you can always ask, because that is very important. And for that, our numbers are very open. That is 0721 105 105 on WhatsApp, 23814. Our SMS code, which is absolutely free of charge. We're live on Facebook on MBCI TV Facebook page. We're live on YouTube on MBCI TV official YouTube page, and on all social media pages at Rachel Kahugu. Kenda pale pia nitaweza kupata ujumbe wako loud and clear, and that will be amazing. Now, why are some of the scans for the common scans? These are the MRI, CT scan. Why is it that for some they are more expensive than others? We're going to be talking about the ECG, because I think that's something different, the heart scans.
Okay.
But before we get there, why is it that some are more expensive than others? What makes it expensive?
Okay.
Yeah.
In general, the modalities, they are not the same price. Of course, a general X-ray is way cheaper compared to an MRI. The same way a CT scan is cheaper compared to an MRI. So of course, when you're having an MRI scan, it will be slightly higher because one, the cost of installing, the cost of maintaining, the cost of serving, and also the cost of the technician doing it. You'd see, for example, generally, as long as you've done medical imaging, you're good to go when it comes to X-rays. But in other countries, most of the time, for you to operate a CT scan or an MRI or even an ultrasound, you might be required to have a higher diploma in ultrasound or even a specific specialization in CT or MRI. So, of course, all these things, they will determine the costing of the imaging. Another thing is the numbers. It's so many people are having X-rays done, so the pricing will be slightly lower compared to the number of people who wants an MRI. Yes, so that is also another factor. Also the detail. MRI is definitely superior.
Very detailed.
Yes, very detailed compared to an X-ray or even a CT. Though for CT and MRI, they complement each other. Yes, you cannot. There are things you can't do really well on CT, but can be very perfect on MRI. And similarly, the things you cannot really appreciate on MRI, but you can very perfectly appreciate on CT. So their pricing are different depending on whatever is being done. Same too, when you're doing a CT scan, some of them cover a wide range. Yes, because when I'm doing a CT scan for only the head and a CT scan for chest, abdomen, pelvic, that's a longer one. So the pricing will also be different. So the clinical question, whatever it is intended to give, and also the numbers will determine the overall cost of the thing.
Okay.
Yes.
Okay. Now let's talk about the heart scans or the heart imaging, because also that's another crucial part. What are there different heart imaging?
Okay.
Yeah, and how does that work?
Basically, majorly, currently, the one that is oftenly used is ultrasound, which
for the heart.
Yes, it's the same machine.
Yeah.
Only that when I'm doing a scan here and when I'm doing a scan for the pregnancy, the thing I'll be holding, which is called a probe, is different.
Okay.
Yes, the probe that I'm using for soft tissue and for pregnancy is different. So similarly, the probe that I'll be using for heart imaging might be different from the one I'm using on the abdomen, but the machine is the same. Only that for echo, we have portable ones, the ones that you can connect to your phone, and you do the scan on the heart. So
on your phone?
Yes, on your phone.
Okay.
Very portable. So technology. Yes. So on echocardiography, it's basically to check the anatomy of the heart. There's most of the time you'll hear ECG na echo. Most of the time ECG stroke echo. So ECG, you're basically checking the rhythm of the heart, okay, the physiology of the heart, how the heart is beating. So it can only tell us whether it's fast, slow, abnormal, or normal.
Okay.
But now echo is going to check the heart chambers, the 4 heart chambers, the main muscles, the major vessels as well, and also the general outlook of how your heart is working, how it looks like and how it's working.
Okay.
Yes.
Okay. What are some of the issues or heart issues that one is checking for when you're doing an ECG or echo scan?
Most of the time, it's for the ECG is the rhythm, whether it's beating too fast or beating too slow or abnormal rhythm. Sometimes fast, sometimes it is not very regular.
What would cause that?
Different medical conditions.
Okay.
Yes, for example, someone who is hypertensive might have a different rhythm compared to someone who is very normal. Someone who works out a lot and someone who doesn't, their heart rhythm won't be the same.
Okay.
But for echo, you'll be checking the heart. There's something called the cardiomyopathy, where your heart muscles are not working the way they should. You may check also whether the heart is having fluid surrounding it. You may also check whether you have a hypertensive disease, and also whether your heart is failing for heart failure. Because of course the pumping ability of the heart will be able to be seen on ultrasound, and when the ejection fraction is not normal or rather below 50, then we know that there's an issue with your heart.
Okay.
Yes.
Okay. All right. And for a question that's also coming in quite a lot is usually for the head scans. So mostly when you're scanning, scans is that the head level?
The brain CT or MRI.
Mostly what are you checking for?
Number one, we might be checking for trauma, fractures, when you've had an accident and you want to check whether any part of your skull has been damaged. The other thing is to check the brain, whether it's normal. And the other thing, the major one mostly, is to check for tumors, where whether you have tumors, and if you do, the location of the tumor. Yes. So most of the time, CT and MRI are used for that. And for the brain, specifically brain imaging, not the entire head scanning. For the brain imaging specifically, MRI is superior compared to CT scan. Yes, but when I want to check also the bones, the spaces in the brain, and the vessels, the blood vessels, CT is a good choice.
Yes. You know why I think that's very interesting? Because I feel like you're able to just get every part of the body, even the parts of the body that you don't really look at. For example, the brain. Sometimes you don't stop to think, how's your brain connected? How is it thinking? You know, we look at the psychology part of it. You know, mental health is very important, but that's not really the brain. That's not really the brain. You never stop to think about that specifically. So just to stop and think that there are people who are very concerned with these parts of our body, I think that's very interesting.
Thank you.
I think that's very interesting. Oh, for trauma, just an example. Say you're looking for trauma and you realize that you have maybe an injury for your brain, on your brain. how do you treat that, or how do you go about that?
All right, it depends with the extent of damage, because some of them will need immediate intervention. So most of the time, the doctor who sent you for that CT scan, they already had a question in their mind that they want to answer.
Okay.
And majorly is how to manage this. Is it conservative? Is it surgical? Is it medical?
Yeah.
So after we've done the scan and we tell them that there's an issue here and the extent is this, they go ahead and decide what management to use.
Okay.
Yes.
Okay. Perfect. Now, we'll be taking a very short break, but as we come back, we'll be coming to now read all the questions that you've sent, but also just look into what exactly we need to, clear about the medical imaging. So if you have any question, please feel free to send in. And then as well, tukimalizia, we'll be having Mumbi. She's your namesake. Yeah. We'll be having Mumbi, who's not the doctor, who is Sarah Mumbi, will be helping us just go through some of the tips that we've picked from the discussion that we've had, or what are the main points that you need to have gotten. Maybe this is for you who just joined us now, who wasn't here since 8, because we've talked a lot about a lot of things that are very important. But for now, we'll be taking a break, and in this break, we'll be looking at healthy living. And this is a segment that just helps us to know what exactly we're supposed to do to live a healthy life.
Good morning and welcome back to Afya Clinic. Today on Healthy Living, we'll be talking about something many people hear at hospitals but don't fully understand: medical imaging. Medical imaging simply refers to the use of technology to take pictures of the inside of the body without surgery. These pictures helps doctors see what's beneath the skin, whether in the bones, organs or tissues, so that they can make accurate diagnosis and provide the right treatment. There are different types of medical imaging, each serving a unique purpose. First off, X-rays. These are the most common and are especially used for checking broken bones, chest problems like pneumonia or dental issues. Ultrasound. This uses sound waves and is safe for pregnant mothers to monitor the baby's development. It is also used to check organs like the liver, kidneys and the heart. CT scan, that is computerized tomography. This gives a more detailed 3D view of internal structures and can detect tumors, internal bleedings or injuries after accidents. MRI, magnetic resonance imaging. This uses magnetic fields to give very clear images, especially useful for the brain, spine and the joints. Last is the mammography. This is a special type of imaging used to detect breast cancer early. Medical imaging is important because it allows for early detection of diseases, guides doctors during treatment, and reduces the need for unnecessary surgeries. For example, catching a tumor early through MRI or detecting pneumonia with a chest X-ray can help save lives. If your doctor recommends an imaging test, don't be afraid. It meant to help, not to harm. Always ask your doctor to explain why a test is needed and what the results mean. Pregnant women should avoid X-rays unless absolutely necessary, but ultrasound is safe. Regular screening like mammograms are very important for protection and early diagnosis. Remember, medical imaging is not just about machines, it's about giving doctors the right tools to care for you. Early diagnosis can make treatment easier and outcomes better. So, next time your doctor suggests an X-ray, an ultrasound or a scan, see it as a step toward protecting your future. Stay informed, stay healthy, and as always, this has been Healthy Living on Afya Clinic.
Perfect. You're back. That is it on the Healthy Living. Thank you so much for staying. As I said before, this is Afya Clinic, and today we are talking about medical imaging. I feel like we've talked about what's really important, but if you have any question, please feel free to ask. We'll be giving a contact, and of course, after we are done, you'd be able to just call, ask any question that you feel is very important. Today, we are having Esther Njokimumbi. She's a radiographer. Yeah, she's a radiographer currently at Mercy Mission right here in Nakuru. Now we have some of the questions that are very, very common, and we'll be answering that as we wind up. Most of the questions tumeshazijibu in the discussion, but if you have any pending question about Atrako Tumejibu, please always feel free to ask. All right. Now, that said and done, a very common question is the ultrasound. Is it able to give the gender of the baby 100%?
Yes.
Is it usually like really accurate?
Yes, it's very accurate.
Okay.
Yes, the instances where we have people saying, I was told a boy, but I got a girl, sometimes it's really hard to tell. And the client may really insist on knowing. And probably maybe the one doing the scan is like, I'll just tell you something because now
I would insist.
Which is not okay. I pray we are not doing that out there, dear sonographers. But most of the time the gender is very clear, unless there's an anatomical anomaly where you have people with bi, so you can't really pick on ultrasound. Or when the baby has decided that, you know what, I'm going to surprise you people. So times there's no experts, there's no how do I even say this, there's no 100% way of doing it except for seeing the gender for what it is. So if you can't say it at the very anatomical region, then you cannot be able to tell what it is. But most of the time it's very clear. Almost every time it's very clear. But some of our clients tend to come when it's too late or when it's too early. Yes, so around 18 weeks to 27 weeks is a very good time, because that time I can actually tell you, go walk about, then come back. There's a very high chance of your baby changing position. But the very last days of the last trimester, they maintain the position they're in. So if it is not being visible at that time, we are going to tell you to wait.
Just wait for the baby. And then
just wait for the baby. I would rather tell you that I'm not seeing it clearly than tell you something that I'm not sure. Yes.
Okay. Why do doctors ask for a scan even when you already have blood tests?
Because not everything can be picked on blood tests. The same way not everything can be picked on the scanning. That is why they have to complement each other. That is why most of the time on ultrasound scans, you're going to find terms, or radiology in general, you're going to find terms like features concerning for, findings suggestive of, findings highly likely of. Like they're not really telling you it is this, because some of them, they have to be pathologically proven. So they have to go to the lab and be said that actually it is this. So we can only highlight, we can only say that these findings are most consistent with something, but we cannot tell you that it is actually this for some of them. So the same way, you may have a blood test that is saying you're okay, but then you come to us and we notice your liver is enlarged. How do you tell the size of liver on lab tests? Yes, the same way you cannot tell whether the spleen is enlarged because you have malaria. I cannot tell you that this organ looks larger than usual. So they go and do some lab test and they say, oh, it's like that because the patient has this. So they have to complement each other. You cannot do one without the other. Yes.
Okay. Why do some scans use dye or contrast? Is it dangerous for the body?
Okay, no, contrast is not dangerous for the body, because specific contrast is used for specific reasons and specific instances. For example, when I want to check something like your vessel, your blood vessels, they're very tiny and the blood is flowing there quite fast. So I cannot pick a problem if I do not have something else that can tell me that at this particular point there was narrowing or there was bulging or there was a defect feeling that will show us that, oh, there's a clot there, or there's some enlargement, or there's abnormal dilation of the vessel. So we have to put dye that basically dyes the contrast, that basically coats the area, and you're able to pick whether there's an area that is abnormal. Similar to other parts like the liver or even the stomach. Yes, you're able to pick that at this particular point there is maybe an ulcer or a growth, or because the growth will not opacify, will not pick up the dye the same way as a normal part, as a normal muscle. So the difference between the two is the one that tells you that at this particular point there's an issue.
There's something.
Yes.
Okay, but it's not dangerous at all.
No, it's not dangerous. Yes.
Yeah, that's very important. Can I eat or drink before going for a scan?
It depends with the scan. Yes, because for example, when you're going for pelvic ultrasounds, the doctor will tell you to go take water and have a full bladder. And when you're coming for abdominal ultrasound, especially when the key target is the liver or maybe the gallbladder, they will tell you to starve, because if you eat, it's going to produce the bile. So you'll have a small GB, small gallbladder, and I won't be able to tell, is it small because you're sick, or is it small because it has released the bile for digestion? So you have to, it depends with the examination. For some of them you do not need preparation, but for most of them you need preparation.
Okay.
Yes.
Okay, I hear you. But for the pelvic, you said it's very important for you to take water and make sure that your blood is full.
Yes.
Why?
Because of the anatomical representation of the body. Basically, your uterus is in between the rectum and the bladder. So when the bladder is full, it acts as a window for me to see through. Yes. So when it is poorly distended, I may not be able to appreciate all the organs or all the things that I'm supposed to check. Yes.
Okay. A very interesting one here. What's the most surprising thing you've ever found during a scan?
Oh my God, surprising good or surprising bad?
Both.
Oh, yeah. This one is not very surprising, but I remember we really laughed, I and the patient. She had an IUCD, a coil for family planning, and the baby was literally holding it.
Oh, wow.
And now you cannot remove it until birth. So I was like, don't even stress. Atakuhandia over. Yeah, so there's that one. I used to hear stories that they hold them, but most of the time when I do my scans, they're just somewhere, either lying or they're just somewhere, but not the baby having them, you know? So, but most of the time the baby will not like hold it. Even this particular case, the baby was not like holding it, but it was on the upper part, such that the baby had to come out first. Yes, that is what I meant, because the sac where the baby is found, that thing cannot have perforated into it. Yes. Okay. So holding is not like the literal version, the one we speak about ukunje. Yes, it's like the baby will have to come and then now it will come out. You're going to deliver twins. Only that one will be a coil.
Okay. Surprising bad?
Surprising bad. I don't think it's surprising bad because those are the things we check for, the anomalies. Yes. You might find some very shocking things, some very interesting things. People have 3 kidneys out here and they're not aware. Yes. Because one is tied to another one, and the left one maybe is normal, but the right one, there are 2. Some of them, the kidneys are down here instead of up there. Some people have 2 uteruses. Among other, some people also have their organs misarranged. For example, you're supposed to have most part of your heart on the left, but then you realize theirs most is on the right. You're supposed to have your spleen on your left, but for them, their spleen is on the right. Very rare cases. You see them, personally, I've only experienced that only once. But yeah, they're still there, and they're normal. I wouldn't say that they're not normal, they're just normal, only that the arrangement is different. Their left is our right is their left. Yes.
Okay. There's one, but for her it was a testimony. We had an interview with her here, and she told us how she was diagnosed with her uterus was half.
Oh.
Yeah.
Not complete.
Yeah, it wasn't complete. Like it was literally half, like cut to half. Yeah. And she was told that she couldn't get a baby. Okay. And now she has 3.
Oh my God.
Yeah.
Yes, it happens. You can have a uterus that has 1 horn. It's called a uniconate uterus. You can have one that has 2. That is biconate. You can have another one that they are independently 2. Like you have a uterus and another on the other side. I remember in 2018 in Nairobi West, they had a patient who had 2, and one was gravid, was pregnant, was gravid, but the other one wasn't. Yes.
And is that normal? Well, is that okay?
It's okay. The problem will be when both of them are gravid.
Okay.
Yes, at the same time or at different times. Yes, because one will compress the other too much. Yes. Okay. Yes. I've not done research on that really, on whether we have had successful ones with 2 uteruses. But that particular case was the very first one for us to see too. We were still in school studying.
Yes. Okay. I can imagine what that looks like, especially when you're still in school.
exciting.
Yeah, exciting.
Yeah.
Okay. Now, what would be your parting shots on the conversations that we've had today? Everything about medical imaging.
Okay. Mine is, I love repeating the statement that when I look at the star and I'm in awe of how marvelous the grand creator is, how detailed and particulate he is, I'm reminded of these things every day. When that mom comes, they may not know how much impact you have on us when you come back for your scan, and you were here when it was less than 7 weeks, and now I'm telling you you're at 20, and another time I'm telling you at 30, and another one at 40, and some of them actually come back with their babies to actually show you this is the baby. I think that is a very good thing for us. It really shows us. Ultrasound person, I am more inclined to ultrasound and MRIs, but ultrasound is the one that I've practiced for quite a while, and the sanctity of life cannot be more emphasized. For you to actually appreciate that this is actually a human being at 6 weeks, and the same human being comes into the world at 40 weeks. That's quite a journey. I'm reminded of God's goodness, you know, and I think we are all made stewards in very different ways. Yours is this, someone else it's a different one. For us it's this one. Yes, to actually meet with people, explain to them the differences between all these things, reassure them as well as, you know, experience the good, the bad, all of them. It's whole life. So I am grateful for this, for being here, for being in imaging, and for practicing as well. You know, you can do something and not practice it. So for the chance to practice it, I've had a very, I don't know if to say if I'm lucky, no, I'm blessed, because I've had a very great opportunity to work at very great facilities. Yes, PGH being one of them, the Nakuru War Memorial, Medihill, and now Mercy Mission. And every time you go to different facilities, you meet different type of clients with different character. And some of them encourage you, some of them call you out of your weaknesses, and they make you a better person. So it's a very good field of learning and being a faithful steward. If there's anything I repeat a lot is to hear the master's word. Well done, good and faithful servant. So if that x-ray was fine, if that ultrasound was fine, that is what we look for. Yes, to serve faithfully, diligently, and to excellence.
Perfect. Absolutely love that. I love how you've, you know, God says that everything that we do it for His glory. And I love how you've been able to just bring that together. That as much as you are in the medical field, you absolutely understand that you're just a steward. And you're doing that because that is what God has called you to do. I think that's very beautiful. Thank you. Because you do so well, but not do so well in the line of Christ. And that becomes a miss.
Yes, true.
Yeah, so I think that's really amazing.
Thank you.
Perfect. Thank you so much for being with us in this session.
Thank you.
That has been really amazing, and we've learned so much. Yeah. So thank you so much as well for tuning in. Thank you for being here. Today we've been talking about medical imaging. And if you've missed any part of this, you'd be able to get it from the pointers that we're having. But of course, before we do that, we'll be having a number that you'd call if you need to. Do you have one? Please share.
Okay, my number is 0712 462741. Yes.
Let me take it again.
0712 462741.
Perfect.
Thank you.
Thank you.
All
Thank you so much for that. We've had Esther Njokimombi. She is a radiographer, and we've had an amazing time talking about what you know, medical imaging is all about, and that has been really amazing. Now, we'll be having Mumbi on set, but before we have her, we'll be checking or just looking at the Did You Know? So this segment is one that jogs our mind kidogo. Yeah, and today's Did You Know? We can have it. Says that did you know there's enough DNA in your body to stretch from the sun to Pluto and back 17 times? Okay. Wow, interesting. Did you know that there's enough DNA in your body to stretch from the sun to Pluto and back 17 times? Yani, from the sun to Pluto is long enough, but back and 17 times, that's really long. That's really long. Did you know that? Now, this is for you to just go and do your research to know what the DNA looks like. Yeah. And what does it mean to Kisema that it would belong to stretch from the sun, not even the earth, from the sun to Pluto and back 17 times? And why is that important? Why is it important for you to have the DNA in your body? Or do we just talk about it lightly and you don't even know what that is about? So it's very important for us to just look at that. Now, we are having Mumbi, Sarah, and atutusaidia just to go through what we've been talking about today, right from we started this show, that was at 8. And today we've been talking about medical imaging. Tumekuwa hapa na Esther Kimumbi. She's a radiographer currently at Mercy Mission Hospital. We've talked about x-rays, CT scans, MR, we've talked about ultrasounds, you know, and I think that's really important. Have you learned something?
Yes, I have learned a lot, by the way. This is a topic that I didn't know much.
Yeah.
Like, the only information I had about it, ilikuwa hearsay. You know, the things that you hear in movies, that you hear people talk about, that's the only thing I knew about imaging.
Yeah. Now, you know, the other time we started without introducing you.
Okay, so...
Please have the honors.
Hi, everyone. My name is Mobi Karaoke. Yes.
Sarah after I've said it 15 times. Surely.
I don't know. I rarely use my first name.
Yeah.
Just a preference.
Okay.
Yeah. So I go by Mombi Karaoke. And then also, I'm learning Kikuyu. So, you know, when I tell people Mombi, it makes them talk to me Kikuyu. And in the process, I practice. Yes.
Okay.
Yeah.
Now, interestingly enough, I know don't use my second name.
I don't even know your second name.
See? Yeah.
I don't even think I've ever had anyone call you their second name.
People don't actually call me.
What is your second
name? My second name. We only have very few people who decide to keep shouting about it, and they wonder why they do.
Okay.
Well, I'm just Rachel Kahugo, literally from, should be like primary school.
You've been using Rachel Kahugo?
Yeah.
Wow.
We even have so many people who think Kahugo is my actual name, so when I say it's my surname, they get surprised.
Oh, I also thought it was like your actual name, second name. I didn't know it was a surname.
Yeah. I think I should actually just take it as my name.
Your name, like my name is Rachel Kahugo, and then when you, in the future, when you get another name,
I'll just add
you just add it.
Kahugo.
Yes.
Yeah.
Okay. So
okay, cool. You know, name change is a whole.
It's a
whole conversation.
It's a whole process.
Yeah.
Affidavits, lawyers, like
maybe you should ask Sylvia wanted to talk about it on relationship
talk. Yeah. Yes, and then also I wonder why it's such a process. We need trust too. Now I'm here.
Can you just
just trust me? Like this is me, because they even have to authenticate if it's you for real.
Yeah,
like guys, it's me.
It's me. That's a whole conversation right there. Now we are looking at
imaging.
The tips. What has been your take home?
Other than the tips, the highlight of my show was how she said that she started with saying she's born again.
Yeah.
And then also when she was finishing, she said that, you know, one of her greatest joys would be when she stands before the Father, and then the Father says, "Welcome home, my good and faithful servant."
Yeah.
I find it so beautiful when I meet people in their various industries and they are born again. Because imagine going to a doctor and maybe your case is, you know, hopeless, so to say. But let me tell you, there is one that I know. You know, he's the healer, he's the King of Kings, and he's all these beautiful things. So it really just warms my heart that out there are people that are in the faith and they are being good stewards.
I have a very personal story, and I think this is why we all need to know that as much as like whatever we're doing in our fields, just integrating it with our faith is very important.
Yes.
We lost someone very close. That was it. You know how 2020 was crazy?
2020, a lot happened in 2020.
And then he had one doctor who wasn't a believer. And then he gave us one very crazy report that I hope he'll never give anyone else in life. If you're hearing me, please do better. Do better, surely. You're a medic. So he told us, wow, unajua hizi mambo za reports zikishasema imekuwa mbaya, mimi sidhani mtasaidika.
That's so sad.
I was like, oh my God. Don't you believe in Jesus Christ?
Like, you know, the same yesterday, today, and forevermore. Like,
don't you?
Yeah, it's so sad. You hear so many people, they give up because of doctors' reports. And even the delivery. Just go and put your affairs in order.
That was
in
bad.
short, unaambiwa you are dying. You have like 2
Umemaliza,
months.
by the way.
Andika will.
Yeah.
Like, you know, just give me hope.
We really need to do better
Yes,
there.
we need to do better.
And not only in the medical field.
Yes, in every other field.
For sure.
Yeah, and
For
if you're outside there and you're a practitioner in whatever field, make sure you integrate your faith with your work. Your work should be your worship.
Yep.
Yes.
That was great. That was great. I see what you've done there. Perfect. Now, niwaambia kwa hisho leo mtajua
tunahubiri.
Kuna jinsi hapa. Okay. Now, take us through the tips.
Yes. So the first tip that we have today is medical imaging is a broad field that uses different technologies to create pictures of the inside of the body for diagnosis and treatment. Yeah, so this is just basically the definition of what we talked about. And it's quite broad. So it's using different technologies to create pictures that are inside your body. Yes, another point we have is it is used for diagnosis, monitoring and guiding treatment. So medical imaging is for the doctors to diagnose you. Wajue, what are we dealing with here? You know, ni nini nakusumbua? What is this lump that we are seeing? And then after they've diagnosed you, ni kumonitor. Maybe we are treating it. Is it reducing? What is happening inside your body that we cannot see? And it's also to guide the course of treatment. Now that we have, you know, scanned this lump and we know it's cancerous, what is the next step? Yeah. Another point we have is there are different types of medical imaging such as radiography, sonography and MRI. And we're just going to go and look at, you know, each of this one by one. So radiography is a type of imaging that uses X-rays to see bones, chest, teeth and detect fractures, infections or tumors. And this is not the only thing it does. This is just an example. There is more. And also, fun fact, I didn't know that there are other types of imaging that don't use like X-rays. I thought everything was just X-ray. Even if it's like magnetic, there's going to be rays there and you will get cancer and you will die. And that's how exactly. That's, I don't know, there's a lot of misinformation. Like, I'm so happy about this show because it's quite educative. There's so much misinformation out there. If you get like more than 2 X-rays a year, answer to prepare.
But not surely. We can say that. Yet we have people going for ultrasounds for their fetus almost every month.
See, we thank God for this show. Because I'm so sure there are other people outside there who also didn't know. They thought that when I get an X-ray, ni kwanza niombe tu kwanza so that I know exactly. So
that's very dramatic, but fine.
I know it's quite dramatic. But the whole point was, in my head, I thought that, you know, it's harmful, and then you'll do it again, and it will harm you more and more and more, and then you'll get to a point you're just beyond redemption.
All right.
Yes. So another pointer that we have is sonography uses high-frequency sound waves to create real-time images of organs, tissues, and blood flow. So sonography, in other words, ni ultrasound. This is the one where you use for mothers and other people too. There's also a myth there and a misconception that ultrasound ni a pregnant women only. Tumeambiwa kuna hadi ya macho. So
imagine.
Ya macho. I've never seen that. I'd like to see that. As a matter of fact, I'll look it up to see how it looks like. Another pointer that we have is MRI, which is magnetic resonance imaging. Emphasis on it uses magnetic energy. It's not, you know, it's not X-ray like what people thought. Uses powerful magnets and radio waves to produce highly detailed images of soft tissues like the brain, muscles and spinal cord, and also other things. It's not just brain, muscles and spinal cord. This is just an example. So msiogope uses magnetism. And also the story that happened in July, like we've been told, I saw it. The guy that had a necklace and he was pulled in and he died. It was a gigantic necklace. It was a gigantic, it was, like at first I thought it was a small necklace, but you see like the ones that rappers wear, the big ones,
But why would you have such when you're going for imaging?
I like, genuinely, no one knows what happened. It's just one thing, he's in the room, the next he's screaming, and they couldn't turn off the machine, and unfortunately, they lost him. It was quite sad. And quite sudden. So another pointer that we have is Other specialized scans include PET scans, which reveal cell activity, mammography for breast health, and fluoroscopy that shows live images. I didn't know that about the last one, that there's live images.
That was very
I looked
interesting.
it up, and Google says it's like X-ray on video.
Yeah.
Like it's like an X-ray
but
movie.
live.
Yes, that's exact words, X-ray movie.
Yeah.
Yeah, so it's quite interesting, and I feel quite educated.
Yeah.
Like I can open
Very
a clinic, you know.
Please, that's how we feel each and every other Wednesday.
Yeah,
like
so
me, Dr. Kahuko,
you know, by the end of the year, tufungue hospitali. we can get a degree.
Yeah. No, there's that.
Yeah,
we can go study and then
we become doctors.
So that has been very interesting. I think that's a lot to learn. And it's not something that you just listen to once and you're done for. This is something that you should share with your friends, other people, just to get to learn, because you know knowledge is power.
Yes,
so once you know what exactly you're supposed to do and what to avoid, then that saves you a ton.
And people perish for lack of knowledge. So maybe there's someone who's at home, they've been told, you should go get an X-ray, but they're just, postponing, because they have this idea of how, X-ray has radiation, and you'll go for an X-ray, and in 2 weeks you'll have cancer, So information is key.
Again, with the technology, as Dr. said, is that right now the X-rays, they take less than 5 seconds.
5 seconds, even less, 2.5 seconds.
And then you're done. So that means that's not enough time for the radiation to cause any harm or any effect, for that matter, to your body. So it is absolutely safe. If you need to get any X-ray just to check if there's something wrong with your body, then go do it. It's better than, now you don't know what's happening with your body, then at the end of the day, probably, and God forbid, during the postmortem, it was a problem with the chest, or it was a problem with
that could have been fixed earlier. Like early detection saves people from a lot of things, like medically, mentally, financially, because now when you catch something early, it can be treated in 3 months, and you're done. But then when you catch it late, you are in hospital for years. Sometimes they tell you have permanent damage, and there's nothing they can do about it. Yes.
Perfect. So that has been it for today's show. Thank you so much for coming.
You're welcome.
And for helping us go through the tips. So if this is when you are joining us, thank you so much for being here. You can always get us. We've been live on Facebook. We've been live on YouTube, on MBCI TV. You're able to get a whole discussion there, and I know that you'll learn a thing or two. Okay, thank you so much for being here.
You're welcome.
In absentia, the radiographer that we've had, your namesake, Mombi. Also, thank you so much for being here. Thank you so much, our viewer today. I know that you've gotten to learn so much. So from us is for you to have an amazing rest of the week. Of course, being a Wednesday, it means that you'll be having the lunch hours today from 12:30 to 2:30. So do not miss out. Okay, that's it and done. Do have an amazing rest of the week. Bye-bye.
Bye-bye.